Okay, so this is going to be on Chapter 12, Personality. So our first section is covering psychoanalytic slash psychodynamic theories. Who do you feel would be the best known figure in all of psychology? If you just had to guess, if somebody said, who do you know in psychology before taking this class, what name would have came to your mind? Well, most people would immediately name Sigmund Freud, whose theories have been applied not only to psychology, but to anthropology, sociology, religion, medicine, art, as well as literature. Working from since 1890 until he passed in 1939, Freud developed the theory of personality that has become one of the most influential as well as most controversial theories in all of our sciences. So let's take a moment and we're going to examine some of Freud's most basic and debatable concepts that's found within personality. So some of the concepts that we're going to be going over in the psychoanalytic theory would be levels of consciousness, the personality structure, defense mechanisms, as well as the psychosexual stages of development. So in regards to the levels of consciousness, Freud's term of thought or motives about consciousness was that a person is currently aware of his or her remembering. And the preconscious is Freud's term for thoughts or motives that are just lying beneath the surface of our level of awareness. And usually it's easy for us to bring it back to our mind. But in terms of unconscious, Freud's term in regards to the unconscious were thoughts or motives that lie beyond a person's normal awareness, which still exerts great influence on one's behavior. So the iceberg is a good way of looking at those different layers that we possess. At the very top, outside in the air, is our consciousness, our being able to be aware of what's going on around us. And right at that line, just before pre-consciousness, is where our thoughts and feelings are housed. And we can usually in consciousness be able to bring it up like that. Pre-consciousness is just below the surface. Things that we're not going to tackle every day, but when we need it, we're able to bring it right to consciousness. And then, of course, our memories, it'll go deeper in our knowledge base and our memories. Those fall within those preconscious areas. And then we get down into the unconscious. Now we're deep in the water, okay? Parts that we don't really see at all, but it's still there. So when we talk about Freud's personality structure, here we're talking about these three, we call the tripartite, that being the id, the ego, and the superego. Now, according to Freud, id is that primitive, instinctive component of our personality, which kind of works on the pleasure principle. And when I say the pleasure principle, this is a principle that Freud felt our id operates because we want to seek that immediate gratification. In terms of the ego, now we're talking about more of the rational, the decision-making component of our personality that operates according to what we call the reality principle. Now, when we talk about that term, it's a Latin term, ego, meaning I. You know, like me, myself, and I. Well, that's what ego is standing for in Latin. So the reality principle, though, is about how the conscious ego will operate as it seeks to try to delay those gratifications that it be pushing for. That impulse, like, say, for example, you're out, you're getting ready to go make a payment to your rent. You walk past a store that's showing you your favorite pair of sneakers that cost $200. Its impulse is to say, let's go get this. However, ego is going to say, well, what happens if you get those and you can't pay your rent? So The ego will help with the id as far as the impulses go until appropriate type of situations can be found. It's going to try to help work that ego and get the ego to understand you, the id to understand you just can't go out and buy those shoes. Now the super ego, that's our conscious, okay? And when I say conscious, I'm talking about conscience. Not conscious, but conscience, okay? Or just think of it more of our moral component to our personality that helps to incorporate those parental and societal standards of morality that have been instilled in us. And of course, as all principles, we call the morality principle. And this principle is which the superego may operate, probably given those feelings of guilt when we do something we know we really shouldn't have. We ate that chocolate cake knowing that we shouldn't have eaten that chocolate cake because our body's going to suffer for it. So it's kind of telling us you broke the rules and now we're going to pay the price, and now look what you've done. That's superego. Okay? So think of it in terms of this. The id goes out after everything it wants. The ego tries to slow the id down, and I call the ego the executor. They kind of try to keep everything going in a nice balanced format and way for you. Whereas the superego, think of, when you got the little angel on the side whispered in your ear, look, this is the right way to do things. This is the wrong way to do things. You want to stay on the right side. You know you don't want to be a bad person. Don't do it because you're going to be feeling bad afterwards. That's superego's job. All right. So now Freud also talked about how usually the ego has a method in a way to kind of help slow down the id. And its protective method helps to reduce anxiety by kind of stretching and distorting reality just a bit and kind of allow us to deceive ourselves in some ways. These are what we call defense mechanisms, all right? And so the question is, well, why would we use defense mechanisms in the first place? Well, Freud felt that the unconscious conflicts between the id, the ego, and superego would elicit these uncomfortable levels of anxiety and guilt. So we use defense mechanisms to help us kind of relieve that discomfort that we might be going through in terms of our reality at that moment, and even through self-deception. So the question we have to ask ourselves would be, does the relief increase the chances that we'll resort to these defense mechanisms whenever we experience a conflict? Well, for the most part, we can handle different situations. But think about something that might be traumatic. During traumatic times, we might really rely on those defense mechanisms to kind of shore us up and help us to cope. And it's okay for us to put into defense mechanisms. However, the problem might arise that if we rely too much on those mechanisms and we're not facing reality, then it can be problematic. So now, on this slide, what you're going to find is some of the more simple, or not simple, but more of the common type of defense mechanisms that Freud had discussed within his theory. And basically, just know that when the ego fails to satisfy both the id and the superego, because like I told you, it's the executor, it tries to keep balance between all three of them. Anxiety will start to slip into our conscious awareness. And because anxiety is those feelings of uncomfort, people are going to attempt to avoid it. And again, they use it through the defense mechanisms. So an example the textbook provides is that an alcoholic may use their paycheck to buy drinks. And the message for that's the id. It's like, I need something now because I'm feeling anxious, I'm upset, and I need to feel good again. So it's going to go after the drink. And then you might start feeling guilty. Now that's because the superego is going to kick in and say, you know, you shouldn't drink because drinking is harmful for your health. It may reduce the conflict by, the person might reduce their conflict by telling themselves that they deserve this drink because they worked hard for it. What they just did is what we call rationalization. And that's a defense mechanism a lot of people use. They attempt to justify things even when it's not appropriate. Now, there are some defense mechanisms that do distort reality, where there's going to be misrepresentation, and it seems to be for our psychological well-being, so to speak. Okay? So, let's say during a really bad surgery, the doctors and nurses, they might intellectualize the procedure as an unconscious way of dealing with their personal anxieties because something might have went wrong with the surgery. Okay? So we tend to use intellectualization to kind of explain why it was necessary for it to happen. Rationalization, again, is where we're going to justify what we did. But although Freud described so many different kinds of defense mechanisms, he did believe that repression was considered to be the most important type of defense mechanism. This is because repression is that mechanism that allows the ego, or which the ego would prevent most of the unacceptable, anxiety-provoking thoughts from entering our consciousness. It's going to help push it down. It'll keep it within that unconscious area, not even allowing it to float up to the preconscious area. Okay? Other types that was to be known is, and make sure you do the reading, but projection is where I might be projecting things that's gone wrong for me, and I might project it onto you. Or here's a good example. I always say that Freud projected his particular conflicts and issues of childhood onto his theory, in that he felt that sex was a key symbol. Our conflicts and issues of our sexual nature was a key component to why we may demonstrate issues and problems. To me, he projected his own thoughts about his own sexual life and activities and placed that within his theory. So that's a form of projection. There's also denial. Denial, of course, you're just rejecting whatever the truth and reality is at that moment. And the list goes on. So now let's talk a little bit about the psychosexual stages of development. Okay? There are 5 developmental periods that's during which a particular kind of pleasures need to be gratified in order for our personality to develop normally. And when we don't meet these areas, we kind of get stuck, so to speak. We're stuck within that conflict. So according to Freud, strong biological urges residing within the id will push all children through those 5 universal psychosexual stages. And the term psychosexual really reflects Freud's belief that children experience sexual feelings from birth and in different forms from those of adolescents and adults. Freud held that if a child's needs are not met or are overindulged at a particular psychosexual stage, that child might become fixated, and a part of his or her personality will remain stuck in that stage. So additionally, under stress, individuals supposedly might return or regress to a stage at which earlier needs were frustrated or overly gratified. Now, here we're going to take a look at some of the stages. I'm going to ask you to bear with me because my eyes are not its best, and I'm looking at the slides just like you are. So I'm going to move up a little bit so I can know where I'm at when I'm speaking to you in regards to the psychosexual stages. So the first one again is the oral stage, and that's usually between birth and 18 months. It's the mouth is the main feature of the erogenous zone that's going to be in the cause of development for your personality. Now, what happens if we get stuck there? That's the big question. Generally speaking, if a person is overindulged, where they tend to become gullible, they want to eat and swallow everything because the bottle was just the main facet, or the breast, which you don't see here, but it's that weaning from or wasn't weaned from, which is the overindulgence of the bottle or the breast. And pretty much that's when you have gullibility. That's when a person might be overly dependent on someone or extremely passive. Now, underindulgence, meaning that the bottle or the breast was snatched from that baby way too soon, would mean that they might lead that person to aggressiveness, becoming sadistic, having exploitation of others. And Freud felt that, this fixation, particularly in adulthood, orients how we use our lives in terms of eating disorders, substance abuse disorders. If a person starts smoking, it's this need, this fixation that he feels that we're trying to keep something at our mouths. Okay? Now, anal stage. This is from 18 months to approximately 3 years of age. And here we're talking about toilet training, and we're talking about one's anus. Okay? In terms of being stuck at this particular stage, a person's fixation may demonstrate regression, particularly where they might have issues with control, okay, in which they might become compulsive. They might be really neat freaks, so to speak, which we also deem as being anal retentive. And then on the flip side, you have some people that's just junky and messy and just plain old nasty. They don't think about their personal hygiene. That's where a person might not have been guided appropriately toward proper toilet training. Whereas those who were younger, because some people try to get their children off out of their Pampers or diapers around 1 year old. And sometimes that's just too soon. It really depends on the specific child, but according to Freud, if you did it too early and they got stuck there because they tend to have issues and problems, that's when they're more anal retentive. They wasn't allowed the gratification, so to speak, of the process. Now, during the phallic stages, we're looking at 3 to 6 years, and here this is when the genitalia is taking on a new form, in that we have what we call the Oedipus and the electric complexes. Now, this is because pretty much Freud felt that children will develop a love type relationship with the opposite parent, opposite sex parent. So for a boy, for example, Freud felt they would fall in love with their mother, and then they would gain this great feelings of disdain and hate for the father. And that's the Oedipus complex, okay? In terms of the Electra complex, that's where it's the girl falling in love with her father. And you've heard the stories about how women tend to get married to men that's just like their dad. Well, that's kind of what Freud was speaking about in terms of the Electra complex, okay? So know that when he talks about fixation and symptomology here in this stage, he's speaking about those unresolved sexual longings of that opposite sex parent that leads to those long-term resentments, hostility toward the same sex parent. He also felt that boys, like I said, would develop that Oedipus complex or attraction to their mothers, and that young girls, when they're growing up, they develop an attachment to their fathers, And he ultimately felt that because of this, they also gain a sense of penis envy. You might have heard of that before, due to the lack that a female do not have a penis. So he felt that girls really never overcome that envy, the penis envy, and they kind of give up on their rivalry with their mothers because they feel inferior uh, due to their fathers. Yes, I know how it sounds, but as we go on, we'll learn a little bit how it's evolved since Freud's time. Now, the latency period. This is approximately ages 6 into puberty or early adolescence. And here, there's really no erogenous zone to speak of per se. It's just that now they start interacting more with their same-sex peers and developing those type of relationships. And what you can realize and understand that this is a period of time of sexual dormancy. Kids at this point, they're really not thinking too much about their sexual erogenous zones. They just want to be connected and have fun and interact and learn. And so conflicts usually definitely would be able to be resolved during this period. Now, the last stage we're going to look at is genital, and this is during adolescence into adulthood. Okay, now the genitalia returns with a fury because now, as we're in adolescence and we've gone through puberty, we're at that stage in which we want to make a more intimate type of connection with our partners, be that opposite sex or it could be same sex. So more or less, it's during Freud times, it was considered for opposite sex. But we can also consider today that there are individuals whose sexual orientation has them having a preference for the same sex. But in terms of fixations or regressions and in terms for test questions, think about the opposite sex in Freud's theory, because those unsuccessful type of outcomes during this stage would probably lead to sexual relationships that's really not developed through love but just lust. Okay, and usually a person is like a one night stand type of situation. They're not trying to have a long term romance or relationship with the person. There may not be any kind of respect, or they definitely would demonstrate commitment issues. So now, like I mentioned, psychoanalysis and the psychoanalytic theory has evolved over time. And there was a lot of people who initially followed Freud. But as they did, some of those initial followers, they kind of later rebelled, as well as proposed theories of their own. They became known as Neo-Freudians. Okay? And within this circle, they pretty much started another movement in which we started using a lot of their theories as well. Adler, he was the first to leave Freud's circle. Okay, generally speaking, he felt behaviors motivated more than just unconscious forces. He felt that it had more purpose and was goal directed. According to Alfred Adler's individual psychology, which is what we call it, we're motivated more by our goals in life, particularly our goals of obtaining security and overcoming feelings of inferiority. Adler felt that almost anyone suffers from an inferiority complex or those deep feelings of being inadequate or feeling incompetent. It can arise from our feelings of helplessness when we were infants. And according to Adler, these early feelings results in that will to power that kind of take on one or two paths. Being it can either cause children to strive and develop superiority over others through those, through being dominant or showing aggressiveness, being able to have expressions of envy, or more positively, it can cause children to develop their full potential and creativity, as well as gain mastery and control in their lives. Now, another one of Freud followers, Carl Jung, he came up with the analytical psychology. You have psychoanalytic, and then you have Jung's analytical psychology. And here, Jung felt that the personal unconsciousness is created from our individual experiences, where the collective unconscious consists of those primitive images and patterns of thoughts, feelings, and behavior that Jung coined as archetypes. Okay, so now, according to Jung, the collective unconscious is that ancestral memory of our humanity, where supposedly he explains that these similarities within religion, art, symbolism, as well as dream imagery across the cultures, like repeated symbols of the snake in an ancient Egyptian tomb painting, are what we strive and move with. And can you think of other type of explanations that would go along with what he mentions and speak about? Because see, again, he felt that there was two forms of unconscious. He did believe that we had an unconscious, but remember, we had the individual or personal unconscious that strived and dealt with our individual experiences in life. And then there's the collective unconscious, which kind of housed those things that we inherited through our ancestors, through life, through the universal experiences that everyone may have experienced. And just remember about archetypes. Those are those images and patterns of thought, feelings, and behaviors that lives in the collective unconscious. All right. So now, Karen Horney. And yeah, I giggle at it too, because it's like she followed Freud for a while, and I can assume that it, kind of drove her crazy, because they probably cracked jokes on her, being that she was dealing with sexual conflicts and issues with Freud. But she branched out and left on her own, because she kind of had some issues with Freud's way of thinking. Primarily that, he was kind of sexist, and he really treated women as if they were inferior. Excuse me one moment. But pretty much what Horney believed was that children's needs are not met by nurturing parents. He or she might develop actually lasting feelings of helplessness and insecurity, because there's no true attachment. People would respond to this so-called basic anxiety in Horney's view, and then she kind of set the stage later on about adult psychological health, being that she felt that adult personality was shaped by our relationship to our parents as children, not by a fixation of some psychosexual development, as Freud argued. But she believed that a child whose needs were not met by nurturing parents would kind of experience extreme feelings of helplessness and insecurity. And how people would respond to those basic anxiety really determined those emotional, whether or not they had emotional health, or whether there was going to be mental illness. She was also kind of felt to be someone who pushed more for the feminist movement, because as I mentioned, she really didn't believe in penis envy. She felt that that was just devaluing and discriminatory. So, all right. So when we're evaluating the psychoanalytic theories today, there are few true Freudian purists left. I was trained in psychodynamics myself. The graduate school I attended was primarily, the theoretical orientation was in psychodynamics and psychoanalysis. But even being trained under that paradigm, I have changed my construct in which psychodynamics is my foundation, but I also include what is called choice theory or reality therapy uh, by Glasser. I find it to be a good combination because I do feel that events that happen to us in our childhood do oversee what goes on in our personality when we become adults, and that we can get stuck, particularly if we're dealing with conflicts that was unresolved. But what I don't feel is that it all has a sexual connection. What I do feel is that whatever the event might have been, be that if there was child abuse or be just feelings of inferiority or lack of confidence, those are different issues that could occur. But a lot of times what I do feel happens as we grow up to become adults is that we kind of choose to be in a place we are. For example, a person who's depressed, I would say that they are what we call depressing because they'd rather stay there than work themselves out of it. I mean, I can go on forever, which I'm not, but in understanding that, like I mentioned, not everybody is a purist of Freud's theories, but there's more now of a modern type of psychodynamics and as well as psychoanalysts that tend to place less emphasis on those sexual instincts and more on the socio-cultural influences on personality development. There have been criticisms in terms of inadequate data. Many times I say that Freud was considered an artist in the field of psychology rather than a scientist, because the biggest argument is that there's not enough empirical data that would really truly support what his concepts were. So, like the psychosexual stages, it hasn't been really empirically tested. Um, Also, they criticize the fact that there's an overemphasis on sexuality and biology and the unconscious forces. A lot of psychologists today believe that Freud underestimated the role of learning and culture in shaping one's personality. And then I mentioned sexism. A lot of psychologists, starting with Horney, rejected those theories and felt that they were derogatory towards women. So, some enduring influences, though, in regards to the psychoanalytic theory would be, again, the defense mechanisms. There have been several studies that was able to support the existence of defense mechanisms. In terms of the unconscious information processing, a lot of studies that's been done recently, within recent years, have demonstrated that is a lot of information processing that occurs outside of our conscious awareness. Then we have automatic processing, as well as implicit memories in childhood. These insights Freud gave on childhood experiences, we do still consider it to be of great value. Next thing we'll talk about is trait theories. So now we'll talk a little bit more about some trait theorists from several decades ago. An early study of a dictionary terms found that there was almost 4,500 words that would describe personality traits. And Alport, Gordon Alport, way back in 1937, he felt that the best way to understand personality really was to arrange a person's unique traits into a hierarchy of some sort, with the most pervasive or important traits to be listed at the top. Later on, psychologists, they reduced this list of possible personality traits using a statistical method called factor analysis, in which large arrays of data are grouped into more basic units, which is the factors. Now, Raymond Cattell, he condensed this list of traits and he narrowed it down to around 30 to 35 basic characteristics. And then Hans Esnick, he reduced this list even further and described personality as a relationship among three basic types: extroversion, introversion, neuroticism, anxiety, guilt, moodiness. And I'll talk more about him on the next slide. Well, not this side, but let's start with the five-factor model, that being the five basic personality traits. Now, with factor analysis, it's also been used to develop the most promising modern trait theory, that being the five-factor model. Okay, and based on the five-factor model, the trait theory of personality is composed of openness, conscientiousness, extroversion, agreeableness, as well as neuroticism. Now, with openness, here people who rate high in this factor are considered to be original, imaginative, curious. They're open to new ideas, they're artistic, and they're interested in more cultural type pursuits. Those who score low tend to be more conventional, down to earth. They're more narrow-minded within their interests. They're not as artistic or innovative. Interesting enough, though, critical thinkers felt the score higher than others on this factor was to be that, you were more of a critical thinker. So with conscientiousness, now this factor here ranges from responsible, self-discipline, organized, being able to achieve at high end, and would go to the other extreme of irresponsible, careless, impulsive, lazy, and as well as undependable at that lower end of the continuum. Extroversion is a factor that contrasts people who are considered to be sociable, outgoing, talkative, fun-loving, and affectionate. And at the higher end, they would be considered introverted individuals who are more withdrawn, quiet, passive, and reserved at that low end. Agreeableness, these individuals score high in this factor are considered to be good-natured, warm, gentle, cooperative, trusting, and helpful. Low scorers were seen to be more irritable, argumentative, ruthless, suspicious. They don't cooperate much and can be quite vindictive. Now with neuroticism, here we're looking at, and when I say neuroticism, I'm talking about one's emotional stability. But people here that scored high were emotionally unstable, prone to insecurity, anxiety. They might feel guilt, be worried, have mood swings. And on the other end, they're more emotionally stable, in which they would be more calm, more even-tempered, easygoing, and relaxed. Now, trait theories have successfully identified specific personality traits, which allows us to readily compare one person to another. This identification, in turn, has been able to lead us in development of several useful personality measures that will be discussed more toward the end of the chapter. Although trait theories, particularly the five-factor model, have proven to be successful at describing personality, of course, there's criticisms, and the critics, they argued that it fails to offer a casual explanation for why people develop these kind of traits. So along with the trait theories, there's been documentation that's been fairly high in terms of levels of personality stability over one's lifespan. And it's failed to identify which characteristic would last that full lifetime and in which are more likely to change. Like all theories, trait theories have their limits, of course. However, the overarching goal of identifying and describing the most basic traits that define our personality has largely been met. Additionally, these traits have proven to be useful in predicting real-life behaviors. So now let's go back to Hans Esnick. Okay, here Esnick was a personality theorist who really focused on one's temperament, that being those innate genetically based personality differences. And he believed that personality was largely governed by biology. And he viewed people as having at least two specific personality dimensions, that being extroversion versus introversion, and then neuroticism versus stability. Now, I mentioned earlier about a third dimension, and after he collaborated with his wife, and she's Sybil Esnick, she also was a personality theorist. They added a third dimension, and this was called psychoticism versus socialization. And according to their theory, people high on the trait of extroversion are sociable and outgoing and readily will connect with other people, whereas people high on the trait of introversion and have a higher need to be alone. They rarely engage with others. They like solitude, and they limit their interactions with others. Based on the neuroticism stability dimension, individuals here that was on a high on the neuroticism were to be more anxious. They tend to have an overactive sympathetic nervous system, and we remember with sympathetic nervous system, there's the fight or flight response. And then even with low stress, their bodies and emotional states tend to go more into that fight or flight reaction. So in contrast, people that was high on stability, they tend to need more stimulation to be able to activate the flight or fight reactions, and therefore they considered to be more emotionally stable. Within the psychoticism socialization dimension, people who are high on this psychoticism tended to be more independent thinkers. They were considered to be cold. They were nonconformists. They typed quite impulsive, demonstrated antisocial behaviors as well as hostility. And people who are high on the socialization, which oftentimes in the psychoanalytic realms was considered to be super ego control, tended to have a high impulse control, and they were more altruistic, empathic, cooperative, as well as conventional. Now, the major strength of Esnick's model would be that he was one of the first to make his approach to be more quantifiable. And it's perceived to have been more legitimate, as a common criticism of psychological theories would have, that they weren't empirically verifiable. Esnick, he proposed that extroversion was caused by the variability in, the cortical arousal, with introverts characteristically having a higher level of activity in the area than extroverts would. He also hypothesized that neuroticism was determined by individual differences, like within the limbic system. And that's the part of the human brain that involved our emotions and motivations, as well as our emotional associations and memory. Unlike Allport and Cattell's models, though, Esnick's has been criticized for being a little too narrow-minded. All right, so now we're going to talk a little bit about humanistic theories. Humanistic theories of personalities really emphasize each person's internal feelings, thoughts, and sense of basic worth. This is in contrast to Freud's psychoanalytic theory, because humanists, they believe that people are naturally good, or at worst, neutral, and that they possess a natural tendency toward reaching self-actualization, that inborn drive to be able to develop one's talents and capabilities. According to this viewpoint, personality and behavior really depends on how we perceive and interpret the world, not about the traits per se, or the unconscious impulses or rewards and punishments. Humanistic psychology was developed largely through Carl Rogers and Abraham Maslow. Now, in terms of Rogers, let's look at his theory. And he was with us from early 1900s, 1902, and transcended in 1987. The most important component of personality, according to Rogers, was the self, what a person comes to identify as I or me. Now, most Rogerians today who followed Rogers' work will use the term self-concept to refer to all the information and beliefs a person would be having regarding their own nature and unique qualities, as well as their typical behaviors. So according to Rogers, though, mental health, congruence, and our self-concept are all part of our innate biological capacity. And like plants that grow in cracks within the cement, we're born in this world with innate need to be able to survive and to be able to grow and improve and enhance ourselves. So Rogers felt that we should trust our own internal feelings to be able to guide us toward being healthy mentally as well as having overall happiness. One of the major components to Rogers' theories is what we call unconditional positive regard. And that's Rogers' term for love and acceptance with no contingencies attached. You're not judgmental. Some people would mistakenly believe that unconditional positive regard means that we should allow people to do whatever they please. That's not what he was saying. But instead, humanists would separate the value of the person from his or her own behaviors. And pretty much they would accept the person's positive nature while discouraging, those destructive or hostile behaviors. Humanistic psychologists believe in guiding children to be able to control their behavior so that they can develop a healthy sense of self-concept as well as healthy relationships with other people. Now, Abraham Maslow, he created the hierarchy of needs. And although our natural movement would be upward from physical needs toward the highest level, that would be self-actualization, Maslow also believed we sometimes kind of regress and we push back down toward that lower end, that overall he really didn't think that many of us would ever reach self-actualization, particularly under stressful situations. So, like Rogers, Maslow believed that there is a basic goodness to human nature and that a natural tendency towards self-actualization is what we seek. He saw that personality development would be a more natural type of progression that would be from lower and then move up to higher levels. Thus, he created the basic hierarchy of needs. So when we're born, we kind of focus on physiological needs, that being hungry or thirsty. And then as we grow older and we develop, we kind of move up through 4 higher levels. And if you can notice and see on the slide, those levels would be our safety needs, in which we have to desire to feel secure and safe within ourselves as well as around us. We attempt to seek out pleasures and avoid pain at all costs. Maslow felt that we want to be belonging to something and need the desire to connect and feel love. Our esteem will be on the next level, and here we attempt to earn as much respect as possible to gain approval. We try to perform at our best and excel, being in our careers, being with our families. And then finally, Maslow felt that if you was able to successfully move through those levels, then you would ultimately reach self-actualization. And here, this is where you just understand and realize your own potential and that the sky is the limit for you. Now, of course, like every other theory, there's always going to be some kind of criticism. And humanist theories, they have also been criticized. Of course, there's 3 important criticisms, would be the naive assumptions, and some critics, they kind of suggested that humanistic theories are really unduly optimistic and overlooks negative aspects of human nature. So One example they provided in the textbook would be talking about how humanists would explain the immoral politicians, spread of terrorism, humankind's ongoing history of having wars and people killing one another through murder. And then the second issue was poor testability and inadequate evidence. Like a lot of psychoanalytic theory terms and concept, humanistic concepts like unconditional positive regard as well as self-actualization have been really difficult to operationally define, and so it's more difficult to test scientifically. The third item on the critics list would be narrowness. Just like other trait theories, humanist theories pretty much have been criticized for merely describing personality rather than explaining it. So think of it in this terms: where does the motivation of self-actualization really come from? And to say that it's an inborn drive hasn't been able to satisfy those who learn about personality. All right, so now we're going to move on. So as you've just seen, we looked at the psychoanalytic, psychodynamic approach. We looked at trait theories. We've also discussed humanistic theories. And all of them tend to focus on, they focus really on internal personal factors as personality development. Whereas in contrast, a lot of today's theorists, they look at the social cognitive theories, which emphasizes the influence of social interactions with the environment, and then the cognitions are thoughts, feelings, and expectations and values. Now, Albert Bandura stressed that a strong sense of self-efficacy is what's needed. And you'll believe you can generally succeed regardless of past failures and current obstacles. Your self-efficacy will in turn affect which challenges you will choose to be able to accept, as well as the effort that you might put into it in trying to reach your goals. But Bandura's emphasis on self-efficacy was always specific to a particular situation. It really doesn't carry across all situations. Like, for example, the textbook talks about self-defense training and how it significantly would improve women's belief that they could escape from or disable a potential assailant or rapist. But it really doesn't lead to them feeling more comfortable or capable in all areas of their lives. So according to Bandura's concept of reciprocal determinism, self-efficacy beliefs will affect how others will respond to you, influencing your chances for success. And thus, the cognition or thought, I can succeed, will actually affect your behavior. I can succeed, so I'm going to work hard and ask for a promotion. Or I'm going to work hard and I'm going to get an A in my course, which in turn will affect the environment. So that's saying that your boss might recognize your efforts and promote you. I might see all the hard work you've put into your assignments, taking your exams. Thus, I would provide you with an A for completing your work the way it's supposed to be. Now, Julian Rodgers, he had a theory that was similar to Bandura's in that he suggested that learning experiences will create a cognitive expectancy that helps to guide the behavior as well as influence the environment. So, when looking at it, according to Rodder, your behavior or personality will be determined by, one, what you would expect to happen following a specific action. Two, the reinforcement value that will be attached to that specific outcome. In order for you to understand personality and behavior in this concept, Rada would use personality tests to help measure your internal versus external locus of control. So Rada's test would ask people to respond to statements like, people get ahead in this world primarily by luck and connections rather than by hard work and perseverance. Another question might be, when someone doesn't like you, there's little you could do about it. And as you may suspect, people with an external locus of control will actually think that the environment and external forces was the primary control factor over their lives, whereas people with an internal locus of control think that they can control events in their lives through their own efforts. All right, so now looking at the social cognitive theory, we want to look at the strengths as well as some of the weaknesses in the theory. The social cognitive perspectives really hold several attractions. First, it offers a testable objective hypothesis as well as an operationally defined terminology, and it kind of relies mainly on empirical data. What are some of the weaknesses? Well, critics have suggested that social cognitive theories really focus too much on situational influences, and it fails to adequately acknowledge the stability of a personality, as well as looking at unconscious emotional and biological influences. All right, so now let's start speaking about biological theories. There are three major contributors that contributes to personality. We have the brain, and modern research agrees that certain brain areas contributes to some personality characteristics. For instance, modern research talks about how social cognitive theory has used the fMRI brain scans and identified specific areas of the brain believed to be associated with the trait of risk-taking. And then in earlier research, it was also found that there was an increase of EEG activity or electroencephalograph activity that would be found in the left frontal lobes of the brain, and it's associated with sociability or extroversion, whereas greater EEG activity in the right frontal lobes would be associated with shyness or introversion. Now, in terms of neurochemistry, there's a major limitation in regards to research on the brain structures and personality. It's kind of difficult in identifying which structures are uniquely connected with particular personality traits. So, neurochemistry seems to offer more precise data on how biology would influence personality. So, an example being sensation seeking. And we learned and talked about sensation seeking, people that do bungee jumping and all that fun stuff. But it's been consistently linked with levels of monoamine oxidase, or MAO. And that's an enzyme that would regulate levels of the neurotransmitters like dopamine. Dopamine also seems to have been a correlation with novelty seeking as well as extroversion activities. Okay, so how can neurochemistry have such effects? Well, there's been studies that suggested there's high sensation seekers and extroverts that tends to experience less physical arousal than those who are introverts that would be introduced to a similar stimulus. Excuse me. Extroverts have low arousal that's apparently going to be that motivates them to seek out these different situations that's going to help elevate that arousal. Additionally, it's believed that a higher arousal threshold is genetically transmitted. So pretty much, in other words, personality traits like sensation seeking and extroversion actually can be inherited. Now, when we're speaking about genetics, psychology has been working in the area of finding that it's been recently recognized that genetic factors also play an important role in our personalities. So this relative new area called behavioral genetics looks at how it determines the extent to which behavioral differences among people would be due to genetics as opposed to the environment. One way we measure genetic influences would be to compare similarities within the personality between the identical twins and fraternal twins. Remember, identical is monozygotic and fraternal is dizygotic twins. So, an example provided in your textbooks discusses about heritability of the five-factor model of personality traits and how it suggests that genetic factors contribute to approximately 40 to 50% of the personality. Now, multiple personality influences. Research demonstrates that there are three major factors that would influence personality, that being genetic, those inherited factors, non-shared environmental factors, and that's where how each person's genetic factors react and adjust to the environment, and then shared environmental factors, that being the parental and family experiences one goes through. In terms of the biopsychosocial model, no one personality theory really explains everything that we need to know about the personality. Each theory is going to offer different insights into how a person would develop a distinctive set of characteristics that we label as personality. So that's why instead of adhering to any one particular theory, many psychologists like myself really believe in the biopsychosocial approach. If you remember, I talked about Sigmund Freud, and I expressed that my training was within psychodynamics, but I like to include choice theory or reality therapy. Well, that's what I'm speaking about here. That would be considered a biopsychosocial approach, or the idea that there's several factors, that being biological, psychological, social, that doesn't overlap actually within the contributions to one's personality. Now, let's look at how we measure a personality. So some methods of measuring personality includes interviews. In psychology, we like to use interviews. Unstructured interviews are often going to be used for job and college selection, and then for diagnosed and psychological issues. In an unstructured format, interviews really gives us impressions and allow us to pursue on different hunches that might come about, or it allows us to see how the interviewee will expand on their information. And a lot of times it promises to provide a lot of the personality characteristics of a person. So when we talk about structured type of interviews, now this is when, like myself, if I'm doing a psychological assessment, I'm going to now be looking at specific questions that would allow me to get specific responses that I can then evaluate more objectively and then compare it to what other people may have responded to in other forms of tests. Observations are those that allows us to assess personality by directly and methodically observing behavior. The psychologist will look at examples of specific behaviors and then follow a careful set of evaluation guidelines. So for instance, I might arrange to observe a troubled client's interactions with their family members. Does the client become agitated by the presence of certain family members and not others? Do he or she become passive or withdrawn when asked a direct question? There's thoughtful care taken into observing how a person would respond, how they would behave, how they would react, and this provides invaluable insight into what's going on with the client's personality, as well as how their family dynamics influences them. So an objective test now we're talking about uh, specific inventories that we might use. And its most widely going to be used method would be assessing personality for two particular reasons. Here they can be administered to a large number of people relatively quickly, and tests can be then evaluated by standardized fashion. There are some objective measures, though. That's one specific personality trait, like the sensation seeking we spoke about earlier, or in terms of locus of control. However, psychologists within clinical counseling and industrial settings, they're going to often try to assess the range of personality traits. And to do so, they generally will use what we call a multi-trait or multiphasic type of inventory. Now, one of those being the Myers-Briggs type indicator, which is the MBTI. This looks at four dimensions that comes from Carl Jung's theory of personality. That being, it looks at extroversion to introversion. It's going to be looking at sensing, intuition. It's going to be looking at thinking, feeling, and then it's going to also be looking at judging and perceiving. Now, the most widely studied and clinically used multi-trait test would be the Minnesota Multiphasic Personality Inventory, or what we call the MMPI. Uh, and we use its revisions. There's been several revisions that's been done in the last several years. So widely known, my training, I was trained on the MMPI 2, and that was back in the early 2000s. Now they have the MMPI 2RF, okay? And they're still updating it even still. But this test consists of now is 338 items, whereas when it first came out, it had over 500 different statements that participants would respond to. And that they would say either true, they would say false, or they would say can I say. And here's some examples of the kind of statements that will be found on the MMPI. One would be, my stomach frequently bothers me, or I have enemies who really wish to harm me. Another one, I sometimes hear things that other people cannot hear, or I would like to be a mechanic. Another one, I have never indulged in any unusual sex practices. Now, did you notice that some of these questions are really unusual and they look at abnormal behaviors? Well, although there are many normal type of questions on a full MMPI 2RF exam, it's really designed to pick up on those clinical and counseling issues, and in terms of looking at psychological disorders. The MMPI test items are going to be grouped into 10 clinical scales, and they're measuring a different disorder. They're also going to be looking at the validity scales, which would be designed to reflect the extent to which how respondents might, one, distort their answers. So they might want to try to fake good, um, make themselves appear better than they are. Sometimes, and this is one of those tests that actually can pick up on that. So another thing would be looking for is, are they really understanding the questions that they're reading? Or are they being uncooperative? The MMPI allows us to pick up on all of those different facets. Now, projective techniques. This is where someone in my realm of theoretical orientation, psychodynamics, we rely heavily on projective type of techniques. And just to know, it's more about the ambiguous type of stimuli, like using the Rorschach, which is an ink blot test. This projective test is going to be presented with 10 cards that demonstrate symmetrical, abstract patterns that's known as those ink blots. And we kind of ask respondents to describe what they see in that image. And their responses are thought to be able to provide a projection of whatever unconscious processes they might possess. Okay? Now, also, we have what we call the thematic apperception test, or the TAT. Now, this particular projective test shows a series of ambiguous black and white type of pictures, and then we ask the test taker to create a story related to each of those pictures. And the responses presumably will reflect a projection of their unconscious process. Unlike objective tests, projective tests use unstructured stimuli that can be perceived in many ways. And as the name implies, projective tests is supposedly going to allow us, each person, to project his or her own unconscious conflicts, psychological defenses, their motives, their personality traits, all within test materials. And because the respondents are unable or really unwilling to express their true feelings if asked directly, these ambiguous stimuli will provide an indirect psychological x-ray, you could think of important unconscious processes. Now, are personality measurements accurate? Well, we utilize interviews and observations, and both interviews and observations do provide valuable insights into the personality. But can we truly say, that they're accurate? Well, they are time-consuming, and they can be expensive. Additionally, raters of personality tests frequently will disagree with the evaluation of the same individuals. So interviews and observations would also involve unnatural type of settings. And actually, the very presence of an observer really can alter a subject's behavior. So it's important how we set up one's environment, the test situation. We have to take a look at all of that. In terms of objective tests, like the MMPI-2RF, it provides specific objective information about a broad range of personality traits that's relatively shorter in time span. But they're also subject to at least 3 major criticisms. One would be a deliberate deception, as well as social desirability bias. And then there's some items on the personality inventories that are easily see-through. A test taker would really look at it may intentionally or unintentionally fake a particular response. Like when there was a question that asked them in regards to, do they perform any particular sexual tasks? Some might not want to give us that information. So there are times when we have to be considerate about self-report. But additionally, we want to be able to look at, respondents might want to look good when they're doing these tests, and they'll answer questions in ways that they perceive are going to make them look more socially desirable. So there are validity scales on the MMPI-2RF that's designed to help prevent these type of problems from coming up. The second issue would be diagnostic difficulties. So when inventories are used for diagnosis, there's overlapping items sometimes going to make it difficult to be able to pinpoint a specific diagnosis. In addition, we might have clients with severe disorders that sometimes score within the normal range as the normal clients would. And you may have normal clients demonstrating elevations where we would expect to see someone exhibiting abnormal behaviors would. The third problem would be culture and culture bias and the inappropriate use of the test itself. There are critics who feel that the standards for normalcy on objective tests really fail to recognize the impact of our culture. One example would be taking a look at how Latinos would generally score higher than respondents from North America and Western European cultures on the masculinity-femininity scale of the MMPI-2. However, this tendency really reflects the traditional gender roles, and cultural training more than any individual personality traits. Now, are personality measurements accurate is still the question, and now we look at projective, and this one here has always been the big controversy depending on your theoretical orientation. Projective tests, although are extremely time-consuming to administer, for example, a Rorschach, I know I performed a Rorschach and it took me over 2 hours to perform it on one client. It's also time consuming to administer and as well as interpret. The proponents suggest that that because they're unstructured, respondents are more willing to really talk honestly and on the sensitive topics. But the critics will point out that the reliability and validity of the projective test is still considered lowest of all tests on personality. I will say though, I was a skeptic when I was in training learning how to perform the Rorschach and learning how to do interpretation. When I took that course, I was like, this ain't real. This is not going to tell me anything about a client and their issues. Well, lo and behold, when I did start performing it on clients, it actually was able to provide me with a good insight and picture on a particular diagnosis that I already, and it could have been hindsight because that's the other thing we have to worry about in terms of the test giver's biases. But it did demonstrate a lot of what I was looking for in terms of the unconscious conflicts and content of a particular diagnosis and how it related to the client that I gave it to. But reliability and measures of consistency and being able to reproduce test scores when the test is re-administered is the main thing that allows us to know whether or not this is a useful item or tool. When we talk about validity, the validity is the ability of a test to be able to measure what is designed to measure. So it's important that any test that we have, be that objective or projective, there should be some reliability and validity attached. And through psychology, we often attempt to replicate as well as to try to ensure through different research projects or experiments to ensure that what we're given is going to be actually a useful tool for the masses. Okay, so this completes chapter 12 on personality. Again, please make sure that you click the link below that will send you to the assignment. The assignment will be due on Friday. And as always, remember it is part of your attendance to show that you are participating. So please make sure that you get it done. The weeks are going by quickly. Before you know it, we'll be coming up to finals. One thing I do want to make a note of, and I'll say now, I'll make sure I also include it on the home page, as well as an amendment on the syllabus page, is that there has been readjustments due to the COVID-19 situation. There will no longer be 2 separate exams for graduating seniors or the regular students. There will be one test because, unfortunately, we're not being able to perform our ceremonies and everything like we would normally do. So therefore, testing, I will let you know exactly when our test date will be. I have to make some adjustments, but I did want to at least give you that information. Once again, if there are any questions, any concerns, any worries, do feel free to send me a message in the inbox, and I'll be happy to get back to you. I generally answer any type of messages within 24 hours. I check every day, once in the morning and usually once at night. I'm looking at any type of messages that might be received. So feel free to do that. If you need to talk to me and we need to do a conference, I can set up a conference between the two of us if you have any specific concerns that you would like to talk about. So Again, please be safe. Please make sure that you are following the recommendations of the CDC, of your local authorities, and of the federal government. Do practice social distancing. Do keep with proper hygiene. Make sure you're washing those hands for 20 seconds at least. Sing a little song. Sing your favorite song, the first 2 verses, and that's usually going to represent your 20 seconds. On that note, have a great week, and I will talk to you again next week.